Hi, everyone. Good afternoon. This is County Executive Pat Ryan. I hope you're enjoying these first few days of spring. It was a great spring weekend. I hope everybody had a chance to get outside a little bit safely, of course, but just enjoy the nicer weather. Enjoy, hopefully, what more of that to come as we go forward. And I think we still have work to do here on the vaccination front, on the COVID front. But as we officially hit spring over the weekend and we're really making headway on vaccination, I definitely am increasingly optimistic and positive about where we're going, how we're all sticking through this together. So thank you for that. And again, we're not quite through, but we are really making headway here. Diving into our COVID update for the day with the numbers, as always, leading off, the total number of cases in the county, 12,398. We've now tested over 307,000 residents, obviously some of them multiple times, and had 10,401 recover. Unfortunately, since our last update, we did have one additional COVID fatality. So for all the progress we make, we can't lose sight of that, and of course send our condolences and love to that individual's family and friends and loved ones. Again, I think we're getting closer and closer each day to the point where we won't have that happening, and we can move on. But we are still there, and looking at hospitalizations, they're up slightly since our last update. We currently have 10 hospitalized. It's still about within the norm of what we've had through the month of February and now into March, but we will continue to watch that carefully. The active case count, I've now talked about this for 2 weeks. This is the one real concerning factor. Amidst all the progress and hope for optimism, our active case count in the county is still very concerning. We're at now 1,757. You can see on the chart it's really starting to tick up slowly right now, but if we don't get that under control, especially as we're now headed into another week or two of holiday period with Passover as well as the Easter holiday, with more people being active with the warmer weather coming in the spring, it's just absolutely critical that we not lose sight of the fact that we're still at a much higher rate of infection and active cases than is safe and manageable. And so as you are out and about, please continue to keep that in the back of your mind as you're making decisions about your own precautions, but also understanding that there's a good number of people in the county right now who are still COVID positive and who could put you and your loved ones at risk of spread. We have to continue to operate that way until we can get everybody vaccinated. We'll talk more about this on Thursday in terms of the science behind why we think this is happening, but we largely believe it is predominantly due to the variants, the different COVID variants that have really picked up steam in New York City, and we're seeing make their way into the Hudson Valley, driving up a higher rate of transmission, which then leads to a higher case count. We also do think and can assume that people are getting fatigued and tired of the precautions, understandably. So the intersection of those two things is really driving a very concerning dynamic with just at the moment that we're making real headway on vaccines, we could see COVID and particularly other more virulent variants spreading around the county, which we can't allow to happen. The new positive case rate is the worst it's been in over a month. In the last 96 hours in Ulster County, we were at a 7.5% new positive rate. That is approaching the numbers that we saw when we saw the second wave beginning to build in October and November. And that is another warning sign that as much as we want to be through this and desperately hope to be through this, we are not yet. In the last, again, 96 hours, we've tested 4,860 residents and had 365 new positives. That's 7.5% new infection rate. And that's over a 4-day average. So that is not a one-day anomaly. That's a real problem. And again, on Thursday, myself and/or Dr. Smith, our health commissioner, will talk more about what we think is happening there and what we all need to do to keep this in check until we can get vaccinations complete for everyone. Long-term projections reflect that. You can see, again, a potential real steepening of that curve of cumulative cases if we don't bring that new infection rate down. Good news on hospital capacity continues to be the case. 10 currently hospitalized, 1 in the ICU, but more than sufficient need in the immediate, medium, and long term. And once again, the only way, other than the vaccine, which we are really making progress on, but the only way that we buy ourselves time to get everybody vaccinated is by continuing to wear masks and maintain social distance, to avoid those gatherings, even in the holiday periods, even in the nicer weather, to avoid those social gatherings, and of course to wash hands and use hand sanitizer, continuing to do the proven techniques that we know work, which will allow us to buy some time to get vaccines out to the rest of our residents and then hopefully be able to move through this pandemic finally. On the vaccination front, as I anticipated and said last week, we had a big week last week, and we're going to have another very big week this week in terms of getting shots in arms in Ulster County residents. Over the weekend, this last weekend, we reached a significant milestone. Over 50,000 of our residents have now at least received their first dose of vaccine. That is thanks to a whole host of people, our county health department and team running our county sites, the fact that we now have our state-run site, which we greatly appreciate running at the county fairgrounds and putting through close to 1,000 people a day there. All of our pharmacy partners, our medical provider partners, our hospital providers, everybody is working really hard. Most people, many people, 7 days a week, long days every day, getting the vaccine out to folks, and we will continue to do that. Actually, today, another significant milestone in terms of eligibility. The governor has now opened up eligibility for all residents of the state that are 50 years of age and older. That is a big step. Prior to this, it was 60 plus. To give you a sense of how many people that is in Ulster County, we have a population of 180,000. There are 27,000 people between the age of 50 and 60 in Ulster County. So that's tens of thousands of people more, who are now eligible for the vaccine. So if you are 50 plus or your loved ones, I'll talk more in a moment about how to make sure you get signed up. But that is very good news. And as supply picks up, that'll allow us to get a lot more people vaccinated here in the county. This week for Ulster County, we were allocated about the same as last week, 4,170 doses of COVID vaccine. As a one qualifier, this does not count the state-run site, which is run and accounted for through the state numbers. So if these are the 4,170 are going to our health department, to pharmacies and doctors and so on, and I'll talk more about who they are in a moment. But in addition to the 4,170, we're also, thanks to the state-run site running 7 days a week, that's thousands more additional doses that are now out there and easily accessible, especially to the southern part of the county. So counting in those the state numbers, we're over 10,000 that will be available this week to our Ulster County residents, and so that is great progress again there. Our vaccination locations, in addition to the state-run site this week in Ulster County, include our newly set up county-run site at the Hudson Valley Mall, which is in the former Best Buy location there. We'll be running pods there Thursday, Friday, Saturday, and Sunday. So look out, for those links coming to you if you've signed up. Additionally, you can see our other partners here. We're continuing to work with community leaders, especially in our Black and Brown communities, to ensure that we're proactively getting out to everybody that might have barriers to access to the vaccine. This weekend, we'll be doing another focused pop-up clinic at the Iglesia de Dios Church in Midtown Kingston, in addition to these other practices you see and other partners you see on the site. and we'll continue to do that. If you have a group or a set of folks that are having trouble accessing, please don't hesitate to reach out. Our Office for the Aging is continuing to proactively reach out to our seniors, and as we get more Johnson & Johnson vaccine, which we hope to get this week, we're also going to continue to ramp up our homebound delivery of vaccine program to homebound seniors and other homebound members of our community. So that, as long as we get Johnson & Johnson this week, which we believe we will, that will continue as well. I talked a little bit about the high-level statistics, but to see it by the numbers, our progress in the county in terms of vaccinations, we have crossed, or are about to cross, probably by this point today, we've actually crossed it, another major milestone. 30% now of county residents have received at least their first dose. As of this morning, that number was 52,830 Ulster County residents have received that first dose, and you can see 21,431 have now completed both their first and second doses. As a reminder to all the students and parents and teachers and educators out there in the county, we prioritized our educators and school staff early on to make sure that we would be in a position now coming up to spring break and after spring break to safely reopen our schools. So we continue to make headway there and are approaching, not quite, but approaching 100% of all teachers and educators who want to be vaccinated to be so, including second doses that will be done right around or even before spring break. So we continue to be in a good position there, and all our school districts are working with our health department to be ready with their plans to safely reopen for in-person learning either 4 or 5 days a week as we come into the spring here. If you're out there and have not signed up but want to be vaccinated, 2 main places to go. The first for all of our Ulster County vaccination sites and our pod is to go on our pre-registration list, which is at vaccinateulster.com, vaccinateulster.com. Sign up there. There's also lots of other great information, and you can confirm your eligibility and so on. If you want to go to our state-run site in the county or to one of the other state-run sites in the region or the state, you will go to the New York State the New York State Am I Eligible webpage or call that direct phone number, and they can get you set up at the state sites. So those are really the 2 places to go. And again, as a reminder, effective today, it's 50 years of age plus, in addition to all the comorbidity factors we've talked about, and that's for any age, and in addition to all the other essential worker categories. So more and more people eligible each day, and I think in the coming weeks, frankly, we'll hopefully be opening up to everybody, because I think we're getting close to that point in terms of opening up eligibility for all residents. As we ramp up our vaccination efforts, especially as the county, we continue to need help and public service from community members. We've had hundreds of volunteers working at our vaccination pods, and some of them are getting tired. And so we need more folks willing to help, whether you're a medical professional or not. We have lots of different roles that folks can play. Even if you just do one shift, it's a tremendous service to our county and our residents, and it actually feels pretty darn good to work there and see people receive this life-saving vaccine. And so if you are able to do that even on a weekend, we can work with you on the hours. Please sign up to help work at our vaccination sites. We're calling it volunteer, but we are paying a stipend, so I know, technically that may not make it volunteering. I'll just call it doing public service at a time when we all need folks to step up and serve. Please go sign up at ulstercountyny.gov/volunteer. And again, there will be a stipend to recognize your time and your valuable time in doing that service. And thank you to everybody that has been doing it. We've had some volunteers at every single pod for the last several months, which is just absolutely remarkable. And I want to thank those folks especially. The other thing that I just wanted to briefly hit on, we had a really tough last week in the county, and especially a tough weekend in the county when it comes to gun violence. And of course, nationally, there was a tragic event last night in Colorado that I'm sure we're all aware of and heartbroken by, with 10 lives lost in a mass shooting. But we've had our own wave of gun violence right here in Kingston and Ulster County. And earlier today, I stood with elected leaders, religious and faith leaders, and other community leaders, and we all stood and said, enough is enough. We all have to come together and recognize that we cannot let this cycle of violence and gun violence continue. Just in the last few months, we've lost two of our kids, our young adults, a 12-year-old girl gunned down in front of her 10-year-old brother in December. And then just this last week, a 19-year-old young man about to graduate in just a few months from Kingston High School, an athlete, just a loved member of the school community and our broader community. And that is one of 7 incidents of gun violence, 2 fatal, that we've had in just the last few weeks and months. So we not only stood up and said we have to change things and have to get more proactive and aggressive in curbing this gun violence, but we also announced some initiatives specifically between the county and the city and other partners to really focus on our young people who have really been particularly affected by this. And so one of the most exciting and innovative things that we're going to do, led by the county, the school district, and the city all working together, we're starting a program called Lights on Kingston, which will create at the Kingston High School a safe place for our young people at the times of greatest risk, Friday nights, weekend nights, when we know without a safe place, many of our kids do feel unsafe and don't have anywhere to go. We have parents often working 2 or 3 jobs and maybe can't be there for their kids. And we're going to come together, open up the school, provide a safe place, and have lots of our community partners and service providers all there. That'll be funded between Project Resilience from the county, some city funds, and the school will step up as well to open up the space. And there will be more details to come on this, but we really want to make sure that our young people out there in the community who continue to see their own friends lost to gun violence, that they know that we are here for you and we're going to step up our game to meet this challenge and make sure you have safe places to be and to go. The other program that I announced earlier today is a New York State funded program that is targeted specifically at reducing gun-involved violence. It's called the GIVE program, Gun-Involved Violence Elimination. This year, actually, just in the last few days, Ulster County received over $240,000 in funding from New York State, directly focused on addressing gun violence and focused on 17 counties outside of New York City that have experienced high rates of gun-involved violence. Unfortunately, we are one of those. So these funds will be allocated to the Kingston Police Department, to the county sheriff, to our district attorney, as well as our probation department, and they'll all work together with a data-driven plan to do the work in terms of bringing gun violence down, getting to the root of not just illegal weapons being out there, but all the other dynamics leading to this violence. So there are more steps to be taken there, but seeing our whole community come together earlier this afternoon and say we're not going to stand for this anymore, we have to change and really step up our game, I think that was an important first step, and I want to thank all the leaders that were there with me today, from Mayor Noble to Sheriff Figueroa, District Attorney Clegg, and many others that stood there in solidarity. So residents of the county, we hear your concerns about feeling safe, and I take that very seriously as my most solemn responsibility to protect our residents and ensure that you feel safe. And as we come out of this pandemic, it's even more important that we can do that. So there will be more work to come there as well, and we'll ask your help in that too, just like we've asked your help in a lot of things this difficult year, and you've stepped up. So as we wrap up, thank you to each of you for joining. Thank you to all of our frontline workers, especially that are continuing to do the work, including many members of our law enforcement community that have been out there at risk to themselves throughout this year, keeping our communities safe, working to address the issue of gun violence and other violence. Seeing in Colorado and hearing the story of a 51-year-old father of 7 law enforcement professional who ran into the grocery store and ultimately lost his life, saving countless others, is both absolutely heartbreaking to think about his kids and his family, but a reminder of how many brave folks we have out there that are doing everything they can, and when faced with that difficult challenge, are willing to put it all on the line. So thank you to all of our law enforcement folks that have been doing that in a particularly tough year in many dimensions. Our next update, as I said earlier, will be on Thursday. We'll talk a little bit more about what's going on from a public health perspective as we see these rates of COVID increase. So please tune in for that if you can at 3 p.m. In the meantime, anything you need, you can always call our Recovery Service Center, 845-443-8888. I know there's a lot going on right now, and it seems like more just keeps coming at us. But again, I think back to the moments of our community stepping up and coming together and looking out for each other, and ultimately putting oneself second and putting others first. And if we keep doing that, we can get through this, and we will get through this. And again, thank you to everybody that has been doing that. Stay safe and healthy and resilient, and we will see you on Thursday afternoon.